Hello and welcome everybody to today's webinar, Cool Tools for Engaging Today's Healthcare Students. My name is Samantha Forehand and I will be the moderator for this webinar today. And I'm excited to introduce your presenter, Emily Kuhn. Emily is part of our marketing team here at Realityworks and has been with the company just about 5 years. And she works really closely with educators to kind of hear their stories of how they're using our products and programs and write different stories about that. Recently, Emily was published in the Association of Career and Technical Education's magazine Techniques, focusing on different cool tools you can use in the CTE classroom. And she decided to take that article and create this fun and engaging webinar for you today. So without further ado, I'll pass it over to Emily. And also, if anybody has any questions, feel free to add that into the chat or the question and answer boxes, and we'll get to those right at the end of the webinar.
Thanks, Sam. So what exactly are we going to cover today? Well, we'll start by, I'll just give a quick review about who Realityworks is and why we do what we do. We'll then talk about today's students and the characteristics that make them unique and are spurring changes in those teaching methods. We'll also, of course, review several cool tools that Realityworks offers that educators can use to engage today's students. And I will also provide a sneak peek to some other cool tools that we actually have in development right now. We'll end by reviewing what you can do if you're thinking of refreshing your program. And as Sam just said, we will have time for your questions and answers at the end of the presentation. So again, you can feel free to ask them anytime, and we'll have specific time at the end to answer everything. So with that, let's begin by just quickly reviewing who Realityworks is, especially for those of you who've never attended one of our webinars before or perhaps aren't familiar with our company. We have actually been selling into education for over 20 years. And really what we want to do is partner with educators, whether it's at the organization level or the educator level, to find out what tools and resources you need to address classroom concerns and provide training that addresses those key job skills. What concepts are your students having a hard time grasping, and how can we make your job easier? Those are the questions we ask. And more recently, we've been hearing concerns from educators about teaching today's digital native students, students who are accustomed to immediate feedback, who want to see and touch and feel their learning experiences. To help us address those needs, we've partnered with organizations like ACTI, like the American Welding Society. Our president is chair of the Industry Workforce Needs Coalition, and we have a plethora of partners across state and local organizations and industry groups. And really all of that just helps us find out more about the needs of today's educators. We also seek out opportunities, of course, to speak with today's educators and find out what they're doing. And in fact, that's where the majority of the information that I'm presenting today came from. Years of conversations with experienced educators. And to that end, we focus our product development on 3 prongs: curriculum, learning aids, and then assessments and activities. So what does that mean? Well, it means we create comprehensive learning experiences. We don't want to just create a product. We want to create an experience for you, one that's easy to teach and one that your students will engage with and understand. We start by taking standards-based curriculum, which we work closely with educators at both the secondary and post-secondary level to write. And then we find a great learning aid, or we create one to wrap around that curriculum. And then we finish with different activities and different assessment pieces that you can use really to create a complete program that will fit the needs that you have and be comprehensive and fun for your students. Most of our products and programs will be supplemental to what you're already teaching. These are things you can add in to provide that extra interactivity in your classroom. Now again, our products were developed with that hands-on learning in mind. We created them to make that lasting experience for your students, especially for today's student, who again really wants that information now. They want to get involved and get their hands dirty and interact with what they are learning. So let's start by talking about who are today's students. Well, in the previous slide, I used the term digital native. And what does that really mean? Well, it means it's a term that's often used to describe today's students, most of whom were born after 1995 and are therefore considered members of Generation Z. These students grew up with technology. They have never known a world without media. This means that the standard classroom model where an educator stands in front of the class and lectures doesn't work for all of them. Generation Z students do want to learn and they do want to succeed, but they will disengage with the discussion if they don't feel connected or if they don't see that relevance to real life. In other words, these students do differ from their millennial predecessors. They're different in how they learn, and they're different in how they view the world. Compared to millennials, these students have even shorter attention spans. They have even better technology skills, and they also have an even stronger desire for real-world learning. Studies have shown that they read less than 20% of text, in fact. They're accustomed to immediate feedback. It's that current technology that they've always got in their hands allows them to learn anything, anytime, and anywhere. They literally have the world at their fingertips. And again, today's students aren't satisfied simply hearing about a topic. They want to see it and touch it and feel it. They really do prefer that active, hands-on learning. Really, you're teaching students who are basically goldfish. Seriously, this is a really interesting statistic that we found. The average attention span for the notoriously ill-focused goldfish is a mere 9 seconds. But last year, Microsoft Corporation did a study that showed that people generally now lose concentration after only 8 seconds. So researchers say that this is an indication of the effects of an increasingly digitalized lifestyle on the brain. And really, this is one of the big reasons why students need that active hands-on learning environment. So how do you provide that? How do you teach today's healthcare students? How do you teach goldfish? Well, we've spoken to educators and we've conducted research on this topic, and we found that there are steps that you can take to engage today's digital native students. First, start by getting rid of the 50-minute PowerPoint presentations, or if you have to use them, incorporate quizzes and activities and hands-on demonstrations as often as possible. Give your students more than just a textbook, add in group work and activities. We recommend seeking out project-based learning opportunities like internships. And of course, we recommend providing interactive hands-on learning opportunities. We've heard this overwhelmingly from educators. Today's students are used to having something in their hands, whether it's a cell phone or a tablet or a fidget spinner. And if you can put an awesome hands-on learning tool in the place of one of these other gadgets, they are going to pay attention. Now, what I've said so far today does apply to all of today's CTE students and students in general. But this year, we debuted a line of learning aids and simulators that address a variety of health science skill areas in particular. And I did just want to touch on why we chose health science. Well, research showed us that this is quite an in-demand field, and it will only continue to grow. In fact, the US will actually need 5.6 million more healthcare workers by the year 2020. Demand for the healthcare service industry is actually expected to grow twice as fast as the national economy in the next 8 years. And what's more, we found that there's a really high replacement rate for CNAs. Plus, the number of nurses retiring from the workforce each year has been steadily increasing. In 2010, 40,000 nurses retired, and by 2020, that number is actually going to double. So in other words, students and people who are interested in and suited for healthcare career occupations are going to have excellent job opportunities. And we want to make sure that educators like you have what you need to create engaging learning environments that will foster career exploration opportunities and help your students develop what's going to be truly in-demand job skills. And one way to do that is to bring cool tools into your classroom, ones that engage your students, give those hands-on learning experience, immediate feedback, etc. So now let's talk about a few of those cool tools. Well, I said on the previous slide that US demand for healthcare is expected to grow twice as fast as the national economy in the next 8 years. And what's more, older Americans are retiring in droves. So demand for not only nursing, but geriatric care skills will continue to increase. And that's why I'm excited to talk about two of our favorite cool tools today, our geriatric sensitivity simulators. The geriatric simulator is on the left. That's actually a wearable suit that enables participants to experience many of the common physical conditions of aging, like visual impairment, restricted range of motion, loss of sensation in hands, joint stiffness. And the Geriatric Sensory Impairment Kit, which is on the right, actually contains 3 wearable pieces that simulate common sensory conditions of aging: hearing impairment, arthritis, and hand tremors. So what makes these tools cool for today's students? Well, again, they want to actively engage in their learning opportunities. They want hands-on learning, and these tools are all wearables. They give students the personal experience of trying to accomplish tasks like walking around, opening pill bottles, buttoning shirts, while experiencing what it's like to have that restricted range of motion, that visual impairment, to experience arthritis or hand tremors. And they can begin to understand the way that those physical and sensory challenges can impact daily life, more so if they had simply been told or had read about it. And they can start to develop job skills like geriatric sensitivity. Now, what makes these tools cool for you as the instructor? Well, both of them include curriculum that focuses on both clinical and soft skills, and we've also included pre and post assessments and activity ideas. Educators are using these tools really to set up the realistic patient care practice scenarios. They're having students wear the suit in class, and then they set up a hospital room or a nursing home scenario right in their classroom. In that scenario, the role of the nurse would be even more meaningful because they're able to help the patient or the student wearing the suit perform those physical tasks like sitting down, standing up, walking, and laying down. And they can start to understand the reality of working with elderly patients and really being able to practice that patience and communication while providing physical assistance. And at the same time, the student wearing the simulator is experiencing the physical conditions, the physical impacts of aging on the body. And these are all, of course, those key skills for working with the elderly. Now, two other cool tools that I like to share with you today are our decubitus ulcer simulation kit and our geriatric skin conditions kit. Both of these kits were designed to give students real-world situations in which they can practice diagnosing and cleaning and dressing skin conditions that they'll see on the job. The decubitus ulcer simulation kit contains real lifelike models of stages 1 through 4 pressure ulcers and a heel wound pressure ulcer. And the geriatric skin conditions kit contains 9 models of common geriatric skin conditions. Now, what makes these tools cool for today's students? Well, all of these condition models are pliable and lifelike, and they feature detailed tissues that can be examined. The decubitus ulcer simulation kit actually features, the models in that kit feature tissue degradation, and you can even add pus. They can all be touched and felt, and they provide for really true to life practice scenarios. And again, what makes these tools cool for you as well? Well, they come with curriculum that focuses on both those clinical and soft skills, as well as assessments and activity ideas. The geriatric skin conditions kit also includes 36 flashcards. How are educators using these kits? Well, again, they're using them to create those realistic patient care scenarios. Because these stick to human skin as well as mannequin skin, you can use them to create those scenarios where one student perhaps has the model on them and is in a hospital bed, etc., and the other student, playing the role of the nurse or the CNA, can start practice the scenario from start to finish, from entering the room and greeting the patient and washing their hands to explaining what's about to happen and then locating and identifying the skin condition, properly dressing it, etc. Most customers we talk to do put these models on a real person. And in this scenario, of course, both those hard and those soft skills can be practiced in a real life way. I mentioned earlier that the skin conditions kit also comes with 36 flashcards. That's four for each condition. Instructors are using those to test their students on how to identify the skin conditions, what causes them, what the symptoms are, and how to treat them. They're a really great way to create small group activities where students assess each other or prepare students for those real life practice scenarios. Now, one of our favorite cool tools is our Shaken Baby Simulator. We actually worked with a nurse a few years ago to create this tool to help educate parents and young people and caregivers on the damage that can occur after just a few seconds of shaking. And since then, it's become a tool used also at hospitals and on maternity wards to educate parents and help healthcare professionals identify abuse caused by shaken baby syndrome. So what makes this tool in particular cool? Well, it allows students to actually see what happens when an infant is shaken instead of just being told or reading about the dangers. This infant simulator actually cries, and then when it's shaken and stops crying, LED lights in its skull actually light up to indicate where brain damage has occurred. So students actually get the experience of hearing a baby crying inconsolably, picking it up, shaking it, and then seeing where the damage has occurred. Now here's a kind of a fun use case that I was excited to share with you guys. New Mexico actually has one of the highest rates of shaken baby syndrome and child abuse in the country. And since 2012, the University of New Mexico Hospital System has been using the Shaken Baby Simulator to teach families of newborns about the dangers of shaking a baby. Now, they use this simulator in conjunction with other teaching tools like handouts and videos. But when they call to evaluate parents, which they do 6 or 7 months after they leave the hospital, the one thing they hear the most is how memorable their experience with the simulator was. Parents remember shaking it. They remember hearing that cry and then seeing where brain damage has occurred. Now, you can read this full story, which is really pretty interesting if you go to our website. And really, it's an excellent example of not only that true-to-life care scenario that these simulators help create, but how memorable they really are. Our final cool tool that we'd like to share with you today is our catheterization trainers. Now, when we first started thinking of health science training tools, catheterization models were on our list. We knew we wanted to take what was already out there one step further and make it more realistic. Then one of our own team members, who actually is a certified nursing assistant, shared with us a story about her first time doing pericare on an uncircumcised male. She had never actually seen an uncircumcised male genitalia before. And in hindsight, especially considering, of course, how important proper cleaning is, having had a model to practice on that had an uncircumcised genitalia would have been extremely helpful. So, of course, this story, plus working with other educators and hearing what was needed, really hit home with us the importance of those realistic training tools. So what makes our catheterization models cool tools to today's students? Well, they're actually the most realistic catheterization models on the market. They give students authentic, hands-on practice inserting urethral catheters. You can actually spread folded skin, there's realistic pressure, and the male genitalia features a removable foreskin. And why are they cool for you as the instructor? Well, we did hear that it was a pain point for educators to prepare tools like these for use. So we've actually paired them with a fast fluid management system, which we created to allow you to basically maintain a constantly full, unpressurized bladder. It really makes these catheterization trainers easier for you as the instructor to use as well. So what are instructors doing with these models? Well, again, they're realistic. They're the most realistic catheterization models on the market today. So you can use them to create real-life patient care procedures where your students can, again, practice the big picture of a catheterization procedure, from introducing themselves and washing their hands, explaining what's about to happen, to actually carrying out that insertion process, and with a realistic model that actually does require pressure to move the folds of skin, and to really allows them to determine and to learn and get that experience of how to move that skin and how to work with a patient in a realistic manner. So I just shared a story of how that CNA experience of one of our own team members helped inspire us to create a really realistic catheterization model. And that's a great example of where our ideas come from. They come from speaking with educators and discovering pain points. Now we're always looking for new simulation ideas. So if you have a pain point that you feel could be addressed with a learning aid, feel free to reach out to us. In the meantime, I do want to briefly review 2 products that are currently in development because of what we've heard from educators. We've heard that these topics in particular can be difficult to teach, so we've come up with some simulators that we think can really enhance that experience. In development right now is a Hemiplegia simulator that actually allows students to personally experience what it's like to have one side of their body paralyzed. It's similar to the Geriatric Simulator in that it's a wearable suit, and it allows students to perform those daily activities while experiencing the challenge of not being able to move one side of their body. We also have in development right now a medication management simulator. And that again gives students that personal experience of trying to sort pills and open pill bottles and take out the appropriate amount of medication while wearing glaucoma simulation glasses and gloves that really restrict their sense of touch. Again, creating that experience that's very similar to what elderly patients experience every day. Both of these cool tools can allow students to touch and feel and engage in a really unique learning experience. And of course, we're pairing these with curriculum and assessments and activities to make them easy to use for the instructors. More information on these 2 products in particular will be shared in 2018. So we recommend checking back on our website to stay updated. So now what? I have just shared a plethora of information and product details, and we know it can be overwhelming when deciding to add tools to your program. So where do you start? Well, first, we recommend starting slow and remembering that low fidelity training tools can be just as effective as high fidelity training tools. Second, we recommend you visiting our website. You can actually donate, first of all, a free infographic on experiential learning and why it works for today's students. We created this a few years ago when we really started talking about the concept and looking at the needs of today's students and what they need to really engage and learn. And you can print this for free and hang it in your classroom. You can also find more information as well as product videos and curriculum samples on the products that we share today, as well as our full line of health science training tools that we offer, which also includes tools for injection training and blood pressure training and more. Finally, we recommend if you have a question to call your account manager. They are experienced in assisting educators with revising their program, with finding funding, and of course, they can provide you with a customized quote that really fits your unique program needs.
Okay, well, thank you, Emily. Now we're going to go over to the questions and chat box and see if we have any questions for Emily regarding any of the information presented today.
So at this point, everyone can, if you have a question or a concern that you want to share, use that questions and answers button on your screen or the chat feature. We'll give everyone a minute or so to do that. Well, one question we do hear a lot that we wanted to address is how are people using the geriatric suite at the college level or in those post-secondary programs? We get this because we actually debuted the geriatric simulator in 2016, and we at first saw it used a lot in like family and consumer science classes and health classes at a secondary level, and now we're seeing it more and more in occupational therapy courses and physical therapy courses and geriatric studies. This is where people are going to get that the geriatric patient care skill training to really study what it's like to work with these patients. It's also become a very popular tool in CNA certification courses and nursing programs, of course, where you'd expect it, but also more and more in like occupational therapy and physical therapy and whatnot. All right, well, I'm not seeing any questions or concerns, which is fabulous. If anyone has a question that maybe you think of after the webinar, feel free to reach out. We're always here to help. Our information is on that screen. Otherwise, we appreciate you taking the time to attend today's webinar. And actually, Sam's reminding me right now, thank you, Sam. All attendees of today's webinar will receive an email containing a certificate of completion for attending today's webinar, as well as a recording and a link to our presentation materials. So we'll make sure you have the information you need to do any follow-up or look into any of these products further. Thanks again for taking the time to attend today's webinar.
Thank you.